What is the difference between going to a pediatrician for ADHD testing and going to the psychologist for ADHD testing? I think the old rule of thumb, if we go back to the 80s and 90s, was you'd go into the office, you say, my kid's got a lot of energy, they'd be running around the exam room, the doctor would take a look and go, I agree, we usually use a little medicine for this, what do you think? The parent would go, okay, it's worth a shot, put the child on medicine. Sometimes it would work, sometimes it wouldn't. And unfortunately, that's where I think ADHD and medication started to get a bad rap and a bad reputation, because I can't tell you how many times I hear from parents, oh, I hear these medications cause kids to turn into zombies and they cause all these problems. Well, any medicine will do that if you're not using it for the right thing or you're not using it the correct way. It's not because these are kids necessarily, and stimulant medications have been around so many decades that researchers have run out of things to study with stimulant medications. They don't even look at medications like Ritalin anymore in the research because it's all been done. And so we know these are safe, we know these are effective, but the pediatrician, depending on where you live, will sometimes, at least at this stage in 2025, they will do more of a screening. They might ask you to fill out a checklist, they might even give you one to ask the teacher to fill out, and they'll take a look at that. But oftentimes that won't be enough for them. Back in the day, that might have been. So nowadays, what they'll do is they'll send you to somebody like myself, a psychologist, who can do a formal assessment. And the difference there is that the psychologist is actually going to look inside the child's brain, so to speak. We're going to have them do various activities that require executive function and attention and focus and concentration and impulse control in clinic, where it's highly controlled. The environment and the stage is set for the child to be successful. And that's where you can see true pathology play out, when everything is sort of quiet and calm and ready, and then the only thing that's disrupting that is the child entering the room with their behavior. Then we start gathering data. And so a psychologist who does ADHD testing is going to use some checklists, but they're also going to use more direct measures, which is really my preference, because if you're only using a teacher checklist or a parent checklist, then we have bias. This might be a teacher who says the child is way worse off than they really are because they're burned out from this child for the duration of the year that they've been in class together, or they might undercut it because they get pressure from their administration to not have too many people on plans, or maybe the child is masking, or there's so many other disruptive children in that class that your child doesn't get noticed as much. So I really try to be careful with a questionnaire only approach, just because false positives, false negatives can occur, and we want to make sure we get an accurate assessment. But the child can't escape if they're looked at by a psychologist directly one-on-one. And these are just brain games. These aren't things that are painful or uncomfortable for the child. This is like working with blocks and puzzles and doing different things to try to test their reaction time, their impulse control, their focus, their concentration, their attention. And seeing how that all plays out allows the psychologist to then write up a report that doesn't just say, oh, this child has an attention deficit disorder. It also allows, the psychologist is also going to say, now here's what we can do about it. And a pediatrician is sometimes limited. They might be able to prescribe medication, of course. They might also be able to write a quick script that says, please consider starting an IEP or a 504, but they're not always usually going to be able to weigh in on the child's specific profile. The psychologist will be able to map that out for you, and it'll be a lot more in-depth and a lot more thorough.